Joining us now is Dr. Paul Byers. He is the state epidemiologist for the Mississippi Department of Health. Dr. Byers, thank you for being with us on At Issue.
Absolutely.
What exactly is Zika?
Zika is a mosquito-borne viral illness. That means it's a virus that's transmitted through the bite of an infected mosquito. And it can cause an illness. It can cause symptoms of fever, rash, conjunctivitis, sometimes some joint pain. For most folks who are infected, it's a relatively mild illness. About 80% of folks who are infected don't even have any symptoms. But it does have an impact on pregnant women and the developing babies. And the infection during pregnancy can lead to some pretty significant birth defects.
Let's go back to, do we know where Zika came from, where those first mosquitoes who had it, how they got it?
Well, Zika's been around for a long time. It was first identified back in the 40s in Africa, and it has not caused a whole lot of human illness since that time. It has caused some relatively large outbreaks, but certainly nothing on the scale that we're seeing now in South America and Central America and the Caribbean.
And these cases that we have in the U.S. were all brought here by humans who were infected by mosquitoes in some of these areas you mentioned, correct?
Yeah, travel-associated cases, and we kind of figured that we were going to have them with what was going on in those areas where there's active transmission. But those are the primary cases that we're seeing in the U.S. right now. There are a couple of areas, obviously, in Miami where they've seen local ongoing transmission.
And in that respect, you're talking about a mosquito who's capable of carrying the Zika virus can actually bite a human who is infected with Zika,
right,
then become infected itself, bite another human, and transmit the disease to that human. Is that correct?
Right. So a mosquito would have to bite that infected person at just the right time when they had virus in their blood. And we think that that's about 7 to 10 days after somebody becomes infected. Mm-hmm. And then that would have to be the right type of mosquito. And then that mosquito would have to incubate that virus and then be able to transmit it to another human through a bite. But that's how it works. And so this is in a mosquito human to mosquito cycle.
A lot of things have to line up just right for that to happen, but that is what's happening in Florida, right?
It is.
And what are the chances that will happen here in Mississippi?
Yeah, we hope that it doesn't happen, and that's certainly one of the things that we're working on through our prevention messages to make sure that people understand that. We don't think that we have the type of mosquito that's primarily transmitting this virus right now, but we do have a closely related one in Mississippi for sure. And so we want to make sure that people who come back from areas where there's ongoing transmission do avoid those mosquito exposures so we don't run the risk of our local mosquitoes becoming infected.
You talked about the symptoms. What specifically can happen with a woman who is pregnant if she is infected with the Zika virus?
Well, that infection can then infect the baby. Okay, and that can have some devastating effects on the baby, especially with the brain development and growth. And babies born to infected mothers can have some very significant birth defects. Microcephaly is a condition where the baby's head is small, and that's primarily because the brain has not developed well. But there can be some other birth defects as well, hearing loss or hearing impairment, visual impairment. So there can be some other devastating things that we just don't have a good handle on how long those things may develop after someone is infected.
What if a woman has been pregnant for a while, she's late in her pregnancy, near her delivery date, and is then infected? Is there a point where the baby can be developed enough where it's no longer a concern?
I don't know if we know all of that for sure, but we do know that most of the serious problems can occur when a woman is infected early in her pregnancy. But it has been shown that if a woman is infected any point during her pregnancy, even in the later stages, it can still have an effect on that developing baby.
Let's talk more specifically about microcephaly. That's the condition we've heard the most about as it relates to newborn babies who were born to infected mothers. Tell us a little bit more about what microcephaly is.
Well, like I said, microcephaly is a very small head in these babies, and there can be a spectrum of microcephaly where some of the babies have more significant effects than other babies do. But again, it's a condition where the brain has not developed appropriately, especially the frontal part of the brain. And these babies can have some very devastating birth defects as a result of that impaired brain growth.
And it can affect that child's development and even lifespan, can it not?
It can, and some of those babies regrettably don't live. And you know, there is evidence now that problems can develop even later after a baby is born that shows that if a baby is normal at birth but is born to an infected mother, that those babies may develop some problems later on.
We hear a lot about pregnant women being the ones who have to be most concerned about this.
Yeah.
Does that mean that the rest of the population, it's not as big of an issue, that it's not as big of a threat?
That's a great question. You know, I think you bring up a good point. For pregnant women, certainly that is a group of folks that we want to make sure that they understand that if you're pregnant or you're planning to become pregnant, travel to these areas where there's ongoing active transmission is absolutely not recommended, just to not run the risk of infection during the pregnancy. For people who travel to those areas, though, they do run the risk of coming back to Mississippi or other parts of the United States and potentially infecting local mosquitoes that can lead to local transmission. But there's also sexual transmission that can occur.
And so if a man, for example, travels to one of these hot zones, as we've called them, and is infected with Zika, comes back here, what are the typical symptoms of someone like that?
Well, the symptoms would be the same. If somebody comes back and they're infected with Zika, and they have some of those symptoms that are consistent with infection, like fever, rash, joint pain, conjunctivitis, those kinds of things can be definitely a sign that they need to not have unprotected intercourse or try to have a baby for at least 6 months. But, you know, even people who are showing no symptoms, remember that about 80% of folks who come back who have no symptoms, only about 80% of folks have symptoms who are infected. So there still is a risk that they may transmit that sexually.
So anyone, male or female, who travels to one of these areas, when they come home to the U.S., what should they do? Well,
they need to take precautions to prevent sexual transmission. So for males, and this is a complicated message that may change down the road, but the current guidelines are for males who have symptoms or have been infected and have traveled to those areas, they should abstain from intercourse or have no unprotected intercourse, and certainly don't try to get their partner pregnant for at least 6 months.
6 months.
At least 6 months.
And after 6 months, at least according to the current guidance,
yes,
everything should be okay. If you haven't shown symptoms, we can assume that you don't have Zika.
Right.
Is there a test you can get done to see? Because if you return from one of those areas, or if you fear you might have it but are not showing any symptoms, can a test determine if you have it or not?
There are tests that can determine if you're infected right now. Currently, those tests are not recommended to determine if it's safe to conceive.
But they can determine if you have Zika or not.
They can. If you're symptomatic, they can. So that brings up another good point about what the testing recommendations are. Currently, from the Department of Health, what our recommendations are, any individual who's traveled to one of these areas or has had sex with a partner who has traveled to one of the areas with ongoing transmission and they are symptomatic, they should be tested. Any pregnant woman should be tested if she's traveled or has a sexual partner who's traveled. We test them whether they show symptoms or not.
Let's talk about the effort to prevent this and to cure it. What's happening with research toward a vaccine?
Certainly there is a lot of ongoing research for the development of vaccines, and that certainly could be promising. We're still a ways off before we have a vaccine that would be effective and would be utilized widespread. So I think the real take-home message now is that there are some things that can be done at this point to prevent infection. Certainly, if you do travel, if you have to travel, avoid mosquito exposures as much as you can.
And if you have it, what's the treatment for it?
You know, this is supportive care. It's a mild illness. So, you know, it really, in most people, does not cause a significant or severe illness. Most people recover within just a few days, and it doesn't require hospitalization. It doesn't require any specific treatment.
Do you think enough is being done on the national level to fight this?
I think so. Certainly, it always comes down to funding as well. They are using some monumental efforts in these areas in Florida where there is local transmission, and that requires a lot of resources. And certainly we are working hard at the Department of Health to make sure that we get those messages out, that we work with docs to make sure that testing is available, and to make sure that folks understand what they can do to prevent infection.
We are getting close to wintertime here in Mississippi. It comes later here than it does for a lot of the country. Do you anticipate that as the weather turns colder around the country and the prevalence of mosquitoes is reduced, that this threat will be lessened?
You know, that's going to be hard to say, I think, at this point, and hard to predict about what that threat is going to be. We know that in these areas where there's active transmission now in those countries in South America and Central America and the Caribbean, that they are in certainly a more temperate zone where they may have mosquitoes year-round. And so travelers to those areas are going to need to take the same precautions regardless of what time of year it is.
State Epidemiologist Paul Byers, please stand by with us a moment. We'll visit with you some more in just a moment.